NHA Medical Assistant Crash Course. Question 1. A medical assistant needs to perform a routine urine drug screen for an employment physical exam. Which of the following protocols must be strictly followed to ensure the integrity of the sample? Option A, Random urine collection protocol. Option B, Chain of custody protocol. Option C, First morning void protocol. Option D, Clean catch midstream protocol. The correct answer is option B, Chain of custody protocol. Chain of custody procedures document specimen handling from collection to testing and are essential for legal or employment drug screens. A routine clean catch protocol does not provide the same legal integrity. Question 2. Which of the following standard EKG leads is unipolar and records the electrical activity from the midpoint of the heart to the left arm? Option A, lead I. Option B, lead 2. Option C, ABL. Option D, ABF. The correct answer is option C, ABL. ABL is an augmented unipolar limb lead that views electrical activity toward the left arm. Lead I is bipolar and compares the right arm and left arm electrodes. Question 3. A provider orders a subcutaneous injection of insulin for a patient. At which of the following angles should the medical assistant insert the needle if the patient has a normal amount of subcutaneous tissue? Option A, 15 degrees. Option B, 45 degrees. Option C, 90 degrees. Option D, 10 degrees. The correct answer is option C, 90 degrees. A subcutaneous insulin injection is commonly given at 90 degrees when the patient has normal subcutaneous tissue. A 15-degree angle is used for intradermal injections. Question 4. Which of the following terms refers to the movement of a limb or body part away from the midline of the body? Option A, adduction. Option B, flexion. Option C, abduction. Option D, extension. The correct answer is option C, abduction. Abduction means movement away from the body's midline. Adduction means movement toward the midline. Question 5. A patient is scheduled for a guaiac fecal occult blood test, FOBT. Which of the following dietary restrictions should the medical assistant instruct the patient to follow for 3 days prior to the test? Option A, avoid consuming red meat. Option B, avoid drinking water. Option C, consume high amounts of dairy products. Option D, avoid eating fiber-rich foods. The correct answer is option A, avoid consuming red meat. Red meat should be avoided before a guaiac fecal occult blood test because it can cause false positive results. Water and fiber are generally not restricted unless the provider gives different instructions. Question 6. Which of the following acts focuses on advancing the use of health information technology, specifically rewarding the meaningful use of electronic health records, ERS? Option A, HIPAA. Option B, High-Tech Act. Option C, Controlled Substances Act. Option D, Affordable Care Act. The correct answer is option B, High-Tech Act. The High-Tech Act promoted health information technology and meaningful use of electronic health records. HIPAA is mainly associated with privacy, security, and portability protections. Question 7. A patient exhibits signs of anaphylaxis following an immunization. Which of the following medications should the medical assistant prepare to administer immediately under the provider's direction? Option A, diphenhydramine. Option B, epinephrine. Option C, albuterol. Option D, hydrocortisone. The correct answer is option B, epinephrine. Epinephrine is the first-line emergency medication for anaphylaxis because it reverses airway swelling, bronchospasm, and hypotension. Antihistamines may help symptoms but are not the immediate life-saving treatment. Question 8. A medical assistant notes a provider's order for a medication to be given PRN. How should the assistant interpret this instruction? Option A, immediately. Option B, before meals. Option C, as needed. Option D, by mouth. The correct answer is option C, as needed. PRN means a medication or treatment is given as needed based on symptoms or clinical indication. It does not mean immediately, which is commonly written as stat. Question 9. Which of the following specialized legal terms refers to a provider withdrawing medical care from a patient without giving sufficient notice or providing a qualified replacement? Option A, assault. Option B, malpractice. Option C, abandonment. Option D, defamation. The correct answer is option C, abandonment. Abandonment occurs when a provider ends care without adequate notice or arranging appropriate replacement care. Defamation involves false statements that harm reputation. Question 10. Which of the following values represents a normal respiratory rate for a healthy adult at rest? Option A, 8 to 10 breaths per minute. Option B, 12 to 20 breaths per minute. Option C, 22 to 30 breaths per minute. Option D, 32 to 40 breaths per minute. The correct answer is option B, 12 to 20 breaths per minute. A normal adult resting respiratory rate is 12 to 20 breaths per minute. Rates above this range suggest tachypnea, while rates below it suggest bradypnea. Question 11. Which of the following structures in the respiratory system is the actual site where gas exchange between oxygen and carbon dioxide takes place? Option A, bronchioles. Option B, alveoli. Option C, trachea. Option D, pharynx. The correct answer is option B, alveoli. Alveoli are the microscopic air sacs where oxygen and carbon dioxide exchange occurs across the alveolar capillary membrane. The trachea and bronchi mainly conduct air. Question 12. A medical assistant is preparing to perform a basic wound irrigation. Which of the following solutions should the assistant typically select? Option A, hydrogen peroxide. Option B, isopropyl alcohol. Option C, sterile normal saline, 0.9% sodium chloride. Option D, povidone solution. The correct answer is option C, sterile normal saline, 0.9% sodium chloride. Sterile normal saline is commonly used for basic wound irrigation because it cleanses without damaging tissue. Hydrogen peroxide and alcohol can irritate tissue and delay healing. Question 13. Which of the following components of an insurance plan represents the fixed amount a patient must pay out of pocket at the time of an office visit before receiving services? Option A, deductible. Option B, co-payment. Option C, co-insurance. Option D, premium. The correct answer is option B, co-payment. A co-payment is a fixed out-of-pocket amount paid at the time of service. A deductible is the amount the patient pays before insurance begins covering eligible costs. Question 14. A medical assistant is performing a skin puncture for a blood glucose test. Which of the following steps should the assistant perform immediately after puncturing the skin? Option A, squeeze the finger forcefully to get a large drop of blood. Option B, wipe away the very first drop of blood with clean gauze. Option C, apply the first drop of blood directly to the test strip. Option D, wash the finger with soap and water again. The correct answer is option B, wipe away the very first drop of blood with clean gauze. The first drop from a skin puncture is usually wiped away because it may contain tissue fluid or contaminants. Excessive squeezing can hemolyze the specimen or dilute it with tissue fluid. Question 15. A medical assistant is preparing a sterile field for a minor surgical procedure. Which of the following actions constitutes a break in the sterile technique? Option A, opening the outer wrapper of sterile instruments away from the body first. Option B, reaching across the established sterile field to grab a bottle of saline solution. Option C, placing sterile gauze within the 1-inch border of the sterile drape. Option D, keeping the sterile field in constant, direct line of sight. The correct answer is option B. Reaching across the established sterile field to grab a bottle of saline solution. Reaching across a sterile field contaminates the field because non-sterile clothing or arms may pass over sterile items. The assistant should move around the field rather than reach over it. Question 16. A medical assistant is performing a venipuncture on a patient. According to the standard order of draw, which of the following tubes must be drawn first? Option A, light blue, sodium citrate. Option B, lavender, EDTA. Option C, blood culture bottles. Option D, gold, SST. The correct answer is option C. Blood culture bottles. Blood culture bottles are drawn first in the order of draw to reduce contamination risk and preserve specimen integrity. Light blue citrate tubes are drawn after blood cultures. Question 17. A medical assistant is preparing to perform a capillary puncture on an adult patient. Which of the following sites should the assistant select? Option A. The central tip of the index finger. Option B. The lateral plantar surface of the heel. Option C. The slightly off-center tip of the ring finger. Option D. The fleshy webbed area between the thumb and index finger. The correct answer is option C. The slightly off-center tip of the ring finger. For adult capillary puncture, the slightly off-center palmar surface of the ring or middle finger is preferred. The central fingertip is more painful and has greater risk of bone or nerve injury. Question 18. Which of the following terms describes the complete destruction of all pathogenic microorganisms, including bacterial spores, from an object or surface? Option A, sanitization. Option B, disinfection. Option C, sterilization. Option D, antisepsis. The correct answer is option C. Sterilization. Sterilization destroys all forms of microbial life, including resistant bacterial spores. Disinfection reduces many pathogens but may not reliably kill spores. Question 19. A medical assistant is performing a suture removal procedure. Which of the following instruments should the assistant use to lift and snip the suture material? Option A, hemostat forceps and scalpel. Option B, tissue forceps and suture scissors. Option C, splinter forceps and bandage scissors. Option D, thumb tweezers and utility shears. The correct answer is option B. Tissue forceps and suture scissors. Tissue forceps lift the suture while suture scissors cut it close to the skin. A scalpel is not the routine instrument for standard suture removal. Question 20. A medical assistant is entering a patient's chief complaint into the medical record. Which of the following methods is the most accurate way to document this subjective information? Option A, paraphrase the patient's words into advanced medical terminology. Option B, record the patient's exact words enclosed in quotation marks. Option C, write down what the assistant believes is wrong with the patient. Option D, leave the section blank and let the provider fill it out. The correct answer is option B. Record the patient's exact words enclosed in quotation marks. The chief complaint should be documented in the patient's own words and placed in quotation marks when possible. Rewording it into advanced terminology can change the meaning of subjective data.